Hi everybody, welcome to this video clip about lower back pain. I'm certified Thai massage therapist, cupping therapist, aromatherapist, and I'm also a healer, trainer of healers and Reiki master, and with different certification of helping people. I see people for their pain and issues and challenges every day. And I have often been asked about how to relieve lower back pain in a few minutes. Now, there's no shortcut to healing. That's number one. But there's always something that can help you quickly to relieve so you can go again and search for the real needs of the healing. So know that this is a relief technique and it's not a replacement of treatment. If you have chronic back pain, if you have any physical problem, please go to your healthcare professional and look for proper treatment. But in case some days you have back pain and your therapists are not available on that day and you need to wait for a day or two, you're in excruciating pain, what can you do? Now this can help you. This has been asked by a dear friend of mine. And so if you're watching, this is for you, my dear. And it's very easy that you can administer this at home. You just need a place that you can lie down flat. I would recommend a hard floor because that involves some self-massaging technique that need the sturdiness of the floor. And if you don't have a floor place, you can absolutely do it on a bed, but know that you probably need higher props to create that sturdiness. Now we'll need a towel or a yoga blanket or yoga towel that can roll up into a roll like this to about close to the width of the body, so not too short. Longer is okay, but at least to be able to cover from one side of the ribs to the other side of the ribs. And you're gonna place this in the middle of where you're gonna lie down with a bolster or a sturdy big pillow, and that is sticking out. Think about when you press down the pillow. Now pillows can be very flimsy. So when you press down the pillow, it should at least create about a 4 to 6 inches height when you press it down. So really touch your pillow. If one is not enough, get 2 or even 3. And your blanket should roll up to about the same height when you press down, about like 3 to 4 inches, a little lower than your pillow. Then we'll create a structure here in the middle of where you're gonna lie down. And you're gonna sit on your pillow or your bolster at the very front edge of it. And you're pushing down your blanket with your hands so it stays there, it doesn't go anywhere. And slowly bring your elbows down with the feet supporting you on the ground. And you move your elbows down and feel your blanket should be under the starting of your lower back, covering a little bit of your mid back. So it covers mid back and lower back. Now with that, move your elbows out and slowly roll your back down until your shoulders get to the ground. And then you bring your head down. So don't bang your head, please. So make sure your shoulder come down before you bring your head down. Nothing under your head. When you're doing supported back bend, please do not use a pillow because this creates a very weird position for the neck bone. So we want the head flat on the ground just for a few minutes. Even if it is not comfortable, it's okay, just for a few minutes. Now we stretch out the legs into supported back bend to open the front body. Understand that back bend is a very complex situation. And with pain that occurs, sometimes it's not just the back that is needing help. Sometimes it's the front that need opening to create a balance situation in the pelvis. So stop pulling on the back side of the spine. So know that we need a balanced practice of all sides of the spine and all sides of the pelvis to create a supple, supportive, and healthy back. So a lot of time we sit a lot in the cars, sit a lot in the office and create a very weird position for the hip joint in the front. And when we want to stand up, which is like this, it pulls onto the muscle on the inside of the pelvis. And the pelvis reacts by pulling onto the back muscle and creating a very strong and tension kind of pain that screams at you. So first thing first, we open the front body because we all lack this. Because we sit, we drive, and then we do not move enough, and the pelvis need help. Now, if you find that stretching both legs is a little too hard, you can try one leg straight and one knee bend for a minute or so, and then you switch side. So at least
that side that is stretching have a chance to reopen on the front of the hip. And when you practice more of the release, you may be able to stretch both legs. Even with both legs, if you feel that day the lower back is a little tight, open your legs wider so your hip can relax more. And then slowly move towards bringing your legs closer to create more stretch on the front over time. So find your position right now. We'll be here for another few breaths. Now breathing is very important. All cells need oxygen. When you want to heal any cells, you need to give it oxygen. Without oxygen, it cannot regenerate properly. So take deep breaths to where you feel the tightest. Give it a lot of oxygen, a lot of attention, and a lot of love. As a healer, we know love is the strongest power of healing. So you want to heal that part with no judgment, because judgment is not love. Judgment is criticism, is fear. When you want to heal that part, you love. Send in a lot of love. Know that it has pain because it has been serving you over time with a lot of hard work. Now it needs help. When you treat someone that worked for you very hard and come into trouble because they have been working hard, you don't scold them. You don't diminish them. You love them. You appreciate them. This is the same thing for your back. Your back has been helping you, serving you over time. Now it comes into the time that it needs help. So you give it help. You give it love. You don't scold them. You don't say you're bad. You say you're painful. No, you don't do that. You love it. It has served you to get that pain. Remember that. Appreciate that part of you has been working hard. Now we have spent some time to reopen the front of the hips. We'll get to the massage part. So we'll step the feet on the ground in front of the bolster. Lift up the hips slowly. And then move the bolster to the side. So we don't need it for now. And slowly bring your bum down. Now your blanket roll still behind you. If you already have pain, you will feel it now. And that's okay. Just like you go to massage, when the massage therapist pushes the hand onto your painful part, you feel pain, but you know it's for your good. It's the same thing. It's just we replace the massage therapist's hand with a blanket roll. It's the same thing. Let the pain come on, but you move your bum down slowly to get used to it. Let's try to get used to this feeling of intensity and pressure. Again, give it a lot of breath. A lot of breathing, a lot of oxygen, a lot of love to support it. Know that you have this pain because that part has served you a lot over the years. Love it for that. Appreciate all the hard work your back has done for you. Breathe slowly until you get used to that feeling of intensity. Okay? And then we'll start pulling one knee close. Now keep the bum on the ground, tailbone on the ground. And slowly rock your knee close and away from you. Just a little bit is enough. Now you can control how strong or how much by slowing down to create more pressure and pull closer, or speeding up for a little more gentle rocking. So you can try different speed and different intensity by pulling closer and farther away. Work it out for like a minute or so. You start to feel a relief or work over that area. Now you find that, okay, I actually want it lower or higher. You can always have the feet down on the ground and scoot yourself to find the juicy spot. You scoot yourself up to find lower spot, or scoot yourself down to find higher spot on the spine. But always make sure the shoulders stay on the ground and the bum stay on the ground. Okay? So when you've done one side, we go to the other side. Just rock it slightly. Again, find the intensity you want by adjusting the speed and the distance in between you and the knee, closer or farther away. Give it some time for a minute or so. And remember to breathe. Remember the breathing is the most important part. All practice that is for healing are always based on the breathing. Maybe Qigong, maybe Reiki, maybe yoga, maybe even some chiropractic work is all about breathing. Breath is so important. So remain breathing slowly and deeply. Work it out a little bit. Again, if you want it a little higher. Always remember your shoulder and the feet stay on the ground before you scoot yourself to find those juicy spots. Once you find it, settle down and come again. Go as long as you want. Even though I do it for about a minute on each side, you can do longer if you have more pain on one side. And the next move, it's either you stay here. If it is enough for you, you can stop the video now if it is enough for you. The stronger move will be both knees to yourself. Again, bum down on the ground, shoulders stay on the ground, and roll your knees gently in circles. Again, you can adjust the size of the circles and the speed of the circle. Some people like faster circle to have a little more rapid rhythm. Some people like slower or bigger circles to have stronger pressing on the angle. So you'll find, again, you can always find juicy spots, stay there and wiggle a little bit on that one spot before you go on to the circle again. Spend as much time as you want. For me, I'll spend about a minute on each direction. So after you've done one direction of the circle, you go into the other direction of the circle. Again, you can go fast to get some rubbing kind of action, or you can go slow for some pressing technique. And in slow circles, you can always stay in some angle that you find it particularly juicy, particularly strong. Then you can stay for a little while, wiggle it out, or just simply stay there. Remember, breathing is the most important thing. Stay breathing. Again, there's no rule of how long you should stay in either direction. Just take your time until you feel it's done. You can always stop the video or let it run to the end until you're done. Now, when you're done, stretch out your legs. Rest here for another minute or so. Again, breathing. You will feel intensity still linger around from the previous move. Breathe and feel them. Know that it's releasing. It's showing up for releasing. Breathe to release them. It's like you want to breathe it out. Breath by breath. And after a few breaths, when it starts to subside, you can slowly move your feet to your bum. Lift up your hip. Use your hand, hold onto the side of the blanket, pull down towards your feet first, so that you can grab it and pull it to the side. Slowly land your back down, lie flat on the ground. Again, you probably still feel some residual feeling. Breathe to release them. Do it for at least a minute, lying flat on the ground. If you are going to bed, you can just go straight to bed like this. But if you're getting up for the day, after a minute of the breathing, or until you feel all those residual feelings has subsided, enjoy the moment of freedom when there's no more pain, or at least some of the pain has been relieved. Enjoy the relief in any degree. When you enjoy the relief, you're telling your nervous system that, yes, I have a relief. Feels great. And then you can roll yourself to one side. And then take your time and slowly push yourself up.
So I hope you feel relief already. And remember, this is a temporary relief skills. It's not to replace any proper treatment. It's for you to get yourself better so that you can go out and search for professional help. Happy healing, everybody.